Hello, everybody. I want to welcome everyone this evening and thank you for joining us. I am Eileen Thrower. I am the Department Chair for Midwifery and Women's Health at Frontier Nursing University, and it's really exciting to have you all with us tonight, helping us to celebrate National Midwifery Week. So tonight we're going to talk about a lot of different items that may be of interest if you have been thinking about becoming a nurse midwife. Hi, Sherry. Thanks for turning your camera on. I would invite anybody that would be interested in turning their camera on to join us because we'd love to see your faces. I'm going to have my peers that are also going to be presenting with me tonight introduce themselves, if you would, Dr. Jacobson and Dr. Lomax.
Hi, everyone. I'm Dr. Noelle Jacobson. Welcome to So You Want to Be a Nurse Midwife. So excited that you're joining us this evening. I am the interim clinical director for the Department of Nurse-Midwifery and Women's Health. Welcome.
Hi, everybody. Welcome. We're so excited to have you all. I'm Dr. Janine Lomax. I'm the clinical transition coordinator for Midwifery and Women's Health.
And we also have Dr. Freed with us tonight, and I'm going to ask Eva if she'll introduce herself.
Hi, I'm Eva Freed. I'm in Columbus, Ohio. I am the incoming clinical director for Midwifery and Women's Health here at Frontier.
And I didn't mention, I live in Athens, Georgia. Dr. Jacobson lives in Orlando, Florida, and Dr. Lomax lives nearby in Georgia, another Georgia resident in Fayetteville. So like yourselves, you'll see that we're all over the country, and we're just excited to be here to have the opportunity to chat with you a little bit tonight about some things that that we think would be important for you to know if you're thinking about nurse midwifery. We want to talk about the paths to becoming a midwife and a little bit about what we think would be the most important for you to know about the experience of being a student midwife, and then actually as a little bit of things that we think might be interesting for you to know about being a nurse midwife. So let's just start off really quickly with a few definitions, just so that everybody is kind of on the same page. We know that midwifery, the concept of midwifery can be a little confusing in this country because there are lots of different pathways, educational pathways to becoming a midwife. There are lots of different versions of midwifery. And then there are a lot of different ways to be licensed and regulated depending on the state that you live in. So one of the most common, the most common type of midwife in this country is a nurse midwife. And in the majority of states, nurse midwives are actually licensed as an advanced practice nurse. So I live in Georgia, and so in Georgia, I am licensed as an advanced practice registered nurse. I know the same, I believe, is true, Noelle, for you in Florida, and Eva in Ohio as well. So advanced practice registered nurses include nurse practitioners. For us at Frontier, we offer the Women's Health Nurse Practitioner Program as well. We also offer the Family Nurse Practitioner Program and the Psych Mental Health Nurse Practitioner Program. But if you're on this call tonight, I suspect it's because you're more interested in the next thing on the list, which is the Certified Nurse-Midwifery program. Other types of APRNs in the country that are recognized and licensed are CRNAs, our nurse anesthetist peers, and then clinical nurse specialists. So let's look a little bit about CNMs. So CNMs are one of the pathways to midwifery in the country, by far the most common type of midwife in the country. So we are advanced practice registered nurses. And I think for most of us that are drawn to midwifery, one of the big draws is what we all think about is catching babies. And while that is one of the favorite things that midwives do, it's by no means even the thing we spend the most of our time doing. In fact, it ends up being a small percentage of our time. Nurse midwives provide continuing and comprehensive health care for women throughout their lives, from puberty to menopause and beyond. So honestly, we care for patients across the lifespan providing gynecologic health, family planning, antepartum, prenatal care, that intrapartum care, catching those babies, postpartum care, lots of the different things. So the scope of practice is really pretty broad for nurse midwives. We really, as do all advanced practice registered nurses, have a strong emphasis on health promotion, disease prevention, health education, and counseling. The interesting thing about nurse midwives that I think is a little bit unique as opposed to some of our other advanced practice nurse peers is the fact that while our focus and our emphasis is on the care of normal experiences throughout the lifespan, we're also experts in recognizing abnormal situations and managing them, whether that mean that we bring in our physician peers to work as part of a team or even transferring, but certainly it's sort of a dual focus on managing the normal and recognizing what is not normal and then handling that appropriately. So if you are here tonight on the call thinking about being a midwife, what we already know about you is that what you might be hoping is what the top line looks like in the top box here, is that like, I would love to become a midwife. So maybe you've started thinking about this recently, or maybe you've been thinking about it for quite a few months or quite a few years. And for some of you, I know it might even be some decades, because what we also know is that what we think our plan might look like the top, but what really more realistically happens is the bottom. Life has lots of unexpected potholes that we don't see coming. I mean, we've certainly all been in this together for the last 3 years, experiencing a global pandemic, but we know there are lots of other obstacles that you confront on your journey. And one thing that I want to say is that I really, at Frontier, our focus is really on making midwifery education achievable for you, no matter what your path looks like to get here and what your challenges are. We are really strong supporters of coming to midwifery as a profession, and we are really, really committed members of our professional organizations of the American College of Nurse-Midwives. We're all members on your faculty of ACNM, and many of us hold active leadership roles within ACNM. I personally am the program committee chair, so I am working really hard. Dr. Lomax is on that committee with me. She and I are part of a larger team working really hard right now, reading abstracts, putting together the program for our annual meeting that'll be coming up in May. And I want to bring this up right now because I really believe that as we're thinking about midwifery as a profession and what we can do for the people that we care for, I think our professional organization is a really important part of that. And I really encourage all of you to think about becoming student or associate members even now. I think it's an excellent way to network, get to know your peers in the midwifery community, create relationships that will really serve you if on that journey that we just saw towards trying to becoming a midwife. As part of that, I will mention that our annual meeting is in Orlando in May. You can see May 5th to the 6th. Noelle is all about encouraging people to come and visit her in Orlando. So we'd love to see you there. But I really do believe in the mission that we are working towards here at Frontier, and ACNM is a big part of that, being part of that professional community.
Hi, everyone. So my role in ACNM is that I work in the Florida affiliate as a student engagement chair, which is so appropriate for a faculty person in a nurse midwifery program. So I get to marry two things really well together. So like Dr. Thoreau was saying earlier, certified nurse midwives are primary healthcare providers to women throughout the lifespan. So we do health education and counseling, physical exams, prescribed medications in all 50 states. One of the main medications we prescribe are contraceptions, the contraceptive methods. And of course, we can order laboratory and diagnostic tests and also, of course, interpret those results. Here's a slide where if you're seeing something here and you're like, I wish that was my job, you're in the right place. So we do primary health care, so head to toe care and peri-postmenopausal care for women. Breast health is really critical to services that we provide, pelvic health, sexual health, and we are also licensed to provide treatment for partners for sexually transmitted infections. We also do reproductive health, prenatal care, labor care, support management. We do attend birth, which is always the fun part of our job that we all love. We sell great t-shirts at FNU that say baby catcher. Love that t-shirt. They are always sold in reams for people. We provide postpartum care, both immediately in the birth space, so at the birth center or the home birth practice or the hospital. And we are also, per ACNM, licensed to provide newborn care up to 28 days old. So we have a really broad scope of practice where you get to intersect with people throughout their lifespan and provide them really solid, caring healthcare provision. This is the slide to let you know if you sometimes have thought or had conversations with your friends or family, like you're going back to school, what? It's okay, like you found your people. So we're faculty, so we also love learning. So we just want you to remember learning never ends. And if you're like, I'm not going to finish until I'm 50, guess what? You're going to turn 50 anyway. So you might as well turn 50 with CNM after your name, right? Like it doesn't matter how old you are or where you've been or whatever. If you want to become a CNM, invest in yourself and continue learning because you can do it. If you're here, you have enough motivation to log on a Tuesday night when you maybe had a long day and you're here because you're interested, and that tells us so much about you that you're ready and it's time. One thing we always want to make sure everyone who chooses a profession understands is what the work life really looks like. Midwives tend to have pretty high stress jobs, right? We have a lot of responsibility. Every time you have one patient in pregnancy, you actually have two patients, right? And babies, although with Pitocin, are born very often between Monday and Friday, 8 to 5, and with the high rate of C-sections in the US, they actually are also born on holidays and weekends. Like they don't care that it's July 4th, they still may just come. And so you need to be able to have that flexible life planning so that you're okay being on call in the holidays. And that's something you really need to consider now before you even invest in this education. We have a lot of options for where to work. We can work in birth centers, home birth practices, hospitals. Although the focus of midwifery traditionally has been in normal care and care for the low risk women. The reality is in the US, if you know anything about the US maternal health statistics, then you know that it is rare for women to present to care with few complications. So out of just a natural source of needing healthcare providers, we also do provide high acuity care. And we also, of course, provide outpatient care in offices and clinics. So you have a lot of opportunities in different spaces and places to go practice. So when you look at the outlook for a job, because being a midwife is a calling to many, it is also a job. It's how many people get their paychecks. You want to think about, what does that look like for me in the job market? CNMs are licensed in all 50 states. And when we look at the growth for APRNs, and this statistic came from both CRNAs, NNPs, and CNMs combined, that job growth is 45%. So that's really telling us there is a need for more nurse midwives to come into the market and fill those open job vacancies. So you should be able to find your midwife home when you graduate. When you're a baby midwife and you're ready to go out in the world, you should be able to go ahead and find the place where you're going to work and get that first job, which is so exciting. So this is the thing that stops all of us, right? No one comes in the world with 100% confidence. We question ourselves. We wonder if we can do it. We maybe have fumbled before. Maybe our journey was lots of valleys and not so many peaks. If you're interested in this, apply. And when Frontier admits you, you know you can do it. When we send you that letter of acceptance, that is our seal of approval. Yes, you can become a midwife. So if you're not sure, apply. And when you get that letter, you're going to know, because whenever you start thinking, I can't, just cut off the tea, guys, just cut it off, throw it in the trash, and go ahead and get that done. I'm going to pause for 1 second. I see a question in the chat that I'd like to answer. Do you have a lot of international Canadian applicants? We do accept anyone from any country. You can do your didactic. So the first part of our program is just the coursework piece. So testing, papers, knowledge-based learning. The latter half, like maybe latter third or so of the program, is clinicals. You can only have a clinical site in the United States. You have to have an RN license and you have to go to one of the 50 United States. So you'd have to relocate for that portion. So I hope that answers your question. Now, pay by industry, this is a snapshot, and this is going to depend largely on where you live, right? So are you rural? Are you urban? Are you doing 2 births a month? Are you doing 40 births a month? Are you doing 10 births a shift? Like, those things are going to impact your salary. So this is just sort of a capture of some surveys that were collected, but this is going to be very individual. And it can sometimes depend on your experience level. So more experienced midwives may make more, and that's not even true every place. Some people might be new grads and make as much as the experienced midwife. It's one of those things where you negotiate your salary. And then it also can be degree dependent, where you make more money if you have a doctorate versus a master's, et cetera. Or again, it may not be. It's really a shot in the dark with what you're going to make, but just know that you should be able to have a workable wage when you get to become a CNM.
All right. So midwives, as midwives, we practice the midwifery model of care. And that essentially means that we provide comprehensive care that is inclusive, it's patient-centric, and we consider the whole person and their family. And because of that, midwifery care can lead to very great outcomes. So with the midwifery model of care, we see a 33% lower risk of neonatal mortality, which is imperative, again, considering the maternal mortality, maternal and infant mortality in the US. 31% lower risk of low birth rate babies, 19% lower infant mortality, less use of medical interventions, lower C-section rates, more likely to provide prenatal education that focuses on health promotion and risk reduction, and more likely to provide support with psychological issues, nutrition, breastfeeding, and newborn care. And we have high levels of patient satisfaction because we are there with the patient from the beginning to the end throughout their entire pregnancy. And we are actually we can be there for patients throughout their entire lifespan. So that's adolescence and beyond menopause. So as a midwife, you're going to see very high levels of patient satisfaction. There are different pathways to midwifery. So with these pathways, as a CNM, you are RN with a graduate education from an accredited university, and it has to be accredited for midwifery education. And your certification is through the American Midwifery Certification Board. Now, as a CM, you have to have a graduate education and accreditation commission for midwifery education. And you are also accredited by the American Midwifery Certification Board. With the CPM, a certified practicing midwife, that's apprentice trained by North American Registry of Midwives preceptor or midwifery school, midwifery education accreditation council. And your certification is through North American Registry of Midwifery examination. And you have your traditional midwives and your community midwives, and they are generally apprentice trained. So if we let's talk about some stats regarding midwifery and the different pathways. So as of 2019, we currently have 12,805 certified nurse midwives. We have 119 certified midwives and 2,454 certified practicing midwives. Now, certified nurse midwives and certified midwives attended 369,362 births. So CNMs and CMs attended 90% of all midwife attended births in the US, and that's roughly 9.9% of the total US births. Now, for consideration for admission at Frontier Nursing University in our nurse midwifery program, we just advise if you want to be a certified nurse midwife, you have to be a registered nurse. You have to have a bachelor's degree, but that bachelor's degree does not have to be in nursing. It doesn't have to be a bachelor's of science in nursing. You just need to have a bachelor's degree so that you can qualify to enter our program, which is a graduate program. Now at Frontier Nursing University, we are very committed to being an anti-racist university. Our DEI, which is Diversity, Equity, and Inclusion, our office provides several services. So you'll have access to scholarships, tutoring, writing services, student counseling, anti-racism, and bias reporting councils. We have special interest groups, diversity impact conferences, quarterly speaker series, and we also have mentoring as well. We provide mentoring for our students of color also. So we have a lot of services here to support all of our students because we aim to have a very diverse student body as we have a very diverse faculty body as well. So we advise that you should join an institution that really aligns with your mission, and that's important. That you want to make sure that where you attend your graduate education for nurse midwifery, that the mission and vision of that university is well aligned with your mission and your vision as what you think is best for you as a potential certified nurse midwife. Our mission is to provide accessible nurse midwifery and nurse practitioner education to prepare competent, entrepreneurial, ethical, and compassionate leaders in primary care to serve all individuals with an emphasis on women and families in diverse, rural, and underserved populations. So if your mission is aligned with ours, we would love for you to come and join us here at Frontier. So, I mean, we're very thrilled that you all are considering this career as a midwife. I've had the pleasure of working in a career that I am extremely passionate about. I implore each of you all to find your tribe, though. It's so important that you surround yourself with those that are on the same mission as you. You can connect with experienced midwives. You can also connect with student midwives so you can learn, you know, as much as you need to learn about our rewarding profession, and also, you know, learn about everybody's journey to reaching the goal of becoming a midwife. That's really important because we might have it in our head that it's one way, but as that previous slide show you, there's ebbs and flows, there's peaks and valleys. So you really want to surround yourself with people so you can get a great outlook on this profession.
If you want to have more information on how you apply, how you explore maybe the opportunities that Frontier may offer you, you can go to frontier.edu for more information. There's a lot, you'll find everything online on that website. The application, the links for the application are there. It'll walk you through the whole process. The really nice thing is we have admissions counselors that work with you throughout the entire application process itself. So I think you'll find everything that you need to get started exploring your options at frontier.edu. You're also very welcome to reach out to any of us if you have particular questions. As the department chair, I really focus more on the academic or didactic courses within our curriculum. Dr. Jacobson and Dr. Freed are kind of sharing the role of clinical director right this moment, and their focus is really on the clinical practicum or the clinical experiences that our students focus on. And then Dr. Lomax sort of serves as the bridge in between the two. So she works with students as they are transitioning out of their academic classwork into the clinical side, and has Dr. Lomax, I don't think we talked. Do you want to talk just a minute about clinical bound? Dr. Lomax is actually on campus as we speak. She's the only one of us who's there because she's working with a group of students this week at our clinical bound experience.
Yes, clinical bound is such an exciting time. And I think that you all will feel that it's such a valuable experience. So our students here, they complete all of their didactic courses first. And before they get ready to begin their clinical hours, you know, at their live sites, they will have 1 week with me. Well, it's really a whole entire term with me, but on campus, you will spend 1 week for what we call a clinical bound intensive. And with this clinical bound intensive, you get to experience and participate in many activities such as clinical simulations with standardized patients. We go over a lot of skills. We teach you many skills like suturing, your favorite skill, catching babies. We go over IUD, Nexplanon placement, so all types of contraception. And students are really able to kind of bring everything together that they have learned, and they're given the opportunity to apply it in like a lifelike clinical scenario. So students generally come to clinical bound very nervous, feeling a bit insecure, anxious about starting their clinicals, but by the time they leave clinical bound after 5 short days, they feel much more confident and ready, and they feel like they have the tools that they need to be successful during their clinical. So it's such a fun time. You know, I call it the students' little mini Super Bowl. They have such a good time there, and they feel so accomplished by the time they leave.
All right, thank you, Dr. Lomax. The other thing you might want to know is that so in our program, there are 2 times that it's required for you to come to campus. As Dr. Lomax just described, clinical bound is the second one. The first one is what we call frontier bound, which is an on-campus orientation session that gives you the opportunity to meet your peers, meet some of your faculty and staff at the university. We walk you through a general like 30,000 foot overview of the curriculum, what you're going to, what you'll expect to experience throughout the curriculum. But you also have the opportunity to meet with your academic advisors, get registered for your courses, find out what books you need to buy, talk to your financial aid officers. So folks really enjoy, I think, coming to campus for that frontier bound onboarding session. I think I think most of our students find it to be really meaningful as a time to really get connected to your peers and to your faculty and staff, but also to get a lot done on the road to getting started in our curriculum. But I do welcome you to jot down any of our email addresses and encourage you to reach out if you have specific questions about any parts of the program. You're really more than welcome to contact any of us about any of the parts of the program. Now, I'm going to stop sharing my screen so that we can take your questions, and would love for you to either turn on your mic and ask questions or continue to put questions in the chat box, as I know we have already started getting some questions there.
I was just going to say there's a question about whether or not students find their own clinical site. So Remember, we're a community-based program. So campus is in Kentucky, but you are wherever you are in your community. And one of our goals is for you to become integrated into your midwifery community. And so that is why we already talked to you about joining the American College of Nurse Midwives, your professional organization, as a CNM and as a student nurse midwife and as an RN now. And we encourage you to start getting to know the midwives in your community, to build those relationships, because we know that that's going to help you in securing a clinical site so that you don't have to travel far, and finding your first job, which is always super exciting too. So we do not call you up and say, hey, you're going to go to Chicago for, 1 month, and then you're going to go to Nashville for 3 months to finish up. You are going to design your own plan. So if you want to do a home birth practice, we will determine whether or not the home birth practice is eligible, right? Because we certainly have standards for all of our different sites. If you want to go to a birth center, same thing. A hospital, same thing. We make sure it's eligible within FNU policies. And then we do all the work of the contracting and the insurance for you to make sure we're good to go. And then you rotate there. That doesn't mean that you are alone in this. We have a very robust team. We have clinical advisors who help students preclinically to reach out to sites and to make those connections. We encourage you to come to, like, being the student engagement chair. I always am emailing students, be like, hey, we have a meeting in Orlando, come and have a free dinner, and I'll introduce you to some people, because we have faculty all over the country who you can meet and greet and do that fun stuff with. And then also you have a regional clinical faculty who may know some of the sites in your area. So you are not alone in finding a site, but you have the authority and the ability to design a plan that'll give you the nurse midwifery clinical rotation you want in order to become the midwife you want to be.
Thank you, Dr. Jacobson. Dr. Lomax, will you answer Shamika's question? Are clinical bound students allowed to participate in more than one session? This is helpful if you're a visual learner such as myself.
So with regard to clinical bound, you won't participate in more than one session. Clinical bound is really designed to help you pretty much, like I said, pull everything together. We uncover knowledge gaps during clinical bound. We put you through lifelike experience clinical scenarios to help you sharpen those skills, become more confident. Trust me, 1 week at clinical bound is all you need, and you will be ready to go and start your clinical rotation with your preceptor, because your preceptor is also going to be that support person. Your preceptor is going to help you with that transition from being an RN and transitioning into that role to become an advanced practice nurse and a nurse midwife. So you're not going to need more weeks on campus with us, but you just need that 1 week to get you where you need to be. You'll be fine. You'll have a great time with us.
Hi, this is Shamika Ryan. Thank you so much for answering my question. I just kind of wanted to piggyback off that, and I was just wondering, in the curriculum, are there learning opportunities online that you could visually see stuff? So I applied to the postmaster's program, and I find that reading, you just read and read and read and read, but until I see it or had the interactive videos or things to help pull it all together. So I'm just worried about just massive amounts of content, but nothing to pull it together.
Well, I think we really understand that students have different learning styles. We know they're visual learners, auditory learners, tactile learners. We understand that. And our course coordinators are very intentional about implementing different types of activities that will help various students with various learning types. So you will not just be in a course that doesn't have any degree of interaction, that does not have any visuals. Of course, when you're on campus, that's when you do that kinesthetic learning, that tactile learning, doing your skills. But in your didactic courses, there's various ways that we provide instruction, and you will not just be stuck reading a textbook, reading articles, or just listening, to a PowerPoint presentation.
Okay, 2 more questions. Thank you so much. So I've met a midwife that graduated from your program, Paige Rowland, and she is willing to be a preceptor. The only problem is she says that her job, which is Jefferson Einstein, you have to have a contract in order to do it. So she said to make sure that when I speak to you guys, to find out how do I go about getting a contract, because right now they only are affiliated with the school that the hospital is attached to. So I don't know if that's something that I could email you guys privately if I was to be accepted. But I know she told me to just make sure I ask, because she said that's a problem that a lot of students have if you try to get a hospital experience and the school isn't affiliated with the institution.
Dr. Jacobson, do you want to address that one?
Yeah, so Shamika, I'm not familiar with that particular hospital you mentioned. We have over 4,000 clinical sites nationwide. We certainly don't have a contract with every single office or hospital in the United States, hashtag goals. But when you find a site that's of interest to you, whether it be a hospital or an office, and if we don't have a contract with them, we will reach out to secure a contract. We are willing to contract with any eligible site. So for example, we need a site that has insurance because we insure you as a student. So we need to make sure they meet some minimum qualifications. And then, but we can't ever speak for a site, Shamika. Like if the site says we will only, like we have some people have a mutual contract where they're like, we will only contract with this school, or some hospitals will only take medical students or residents and won't take nurse midwives. And when we have barriers like that, we can't force a site to contract with us. But we have, again, a list of many people in many departments who are willing to work together to try to make that work. We regularly meet with directors of programs to try and negotiate something that will work. And sometimes it even starts with one student and they'll say, oh, you know, we really like Paige and Paige really wants Shamika, so we'll do it for Shamika. I've seen that happen on occasion. And then all of a sudden they're like, Shamika was great. She was the best student we've ever had. And we want to take all the Frontier students, and you open the door for future people. That happened to us with a site here in Florida. So you also can pave the way for future nurse midwife students. I don't want to falsify and guarantee that we can get a contract with us, that site, but I promise you we will do everything we can to make it happen if that's your goal.
Thank you guys so much.
Yeah.
And Shamika, I know Paige, so tell her I said hi.
Will do.
Okay, there's a great question from Faith. How do you find students balancing midwifery school and having a family? Does online seem more flexible than an in-person program? So Faith, this is an excellent question, a very important question. Our students in general almost all have families. Most of our students are caring for children of their own. Many of them are also caring for their aging parents. We really, it is our goal to kind of meet you where you are and to have a lot of flexibility. Our classwork, our coursework is done asynchronously, which means you can do it when it works for you. So you're never going to be told, okay, this class meets, you know, Monday, Wednesday, Friday, 10 to 12. We don't work that way. Classwork is done at on your own schedule. There are some things that are done at scheduled times, but when those things are occurring in a course, you have multiple options to sign up so that you can find one that will work for you. So I said the vast majority of our students have family, lots of family obligations. Almost all of our students work as well. We just know that the reality of life is that you need to pay your bills, and we would like for you to have a place to live and electricity and all those things. So we know that most of you would have to keep working. That is not to say that you can do a master's program without really committing the time to do it. So somehow our students manage to find a way to incorporate all of those things. But I do think that the online or the distance education model lends itself well, particularly Frontier's approach to it, because we have a very intentional approach to make things flexible, to make it work with your schedule. However, having said that, I don't want to underestimate the fact that it does take time, and you have to make the time in your life. So I saw that. So great question, Faith. And again, reach out if you have more questions about that. I'd be happy to talk about that more later. I saw Liberty had a question about circumcisions. That is an advanced skill. And so we don't teach circumcisions in this program. We teach core competencies, and that is an advanced skill that some midwives do add later. And so I actually, quite a few years in my career, did perform circumcisions. We could have a whole other multi-hour discussion about how I felt about that, but I'm not going to go down that rabbit hole. But no, that's not something that you would do as a student for sure. All right, go ahead.
Just wanted to share, like with regards to like family life balance, you know, this is a huge commitment for you to make to becoming a CNM, right? There are going to be sacrifices you have to make. And so this is an important time to start talking to your support system about where the flexibility is in your life. Like maybe you can't volunteer at the soup kitchen anymore. I don't know what your life entails. Maybe you can't teach the dance classes. Maybe whatever it is, right? Maybe you need to not do 2 family vacations and only 1. I don't know what your life is like, and only you know, and you're all adults and you're able to manage your time in whatever way you need to. And you need to do a self-assessment of where you are, what your life looks like, how much time you can give, and whether or not this program works for you, or any program, because every program is going to require significant commitment, right? You have to be reading and watching videos and doing things to learn all the things you need to learn to take exams and write papers and pass courses. And I promise you this though, guys, I've never met anybody who said I should have never become a nurse midwife. Not one person has ever said that to me. We became nurse midwives because that's who we are and that's what we want to be. And we are all so different in every way that you're going to find your tribe somewhere within here. Just, I know because you showed up here today. Get a contract with a local people. Yeah. My joke is always when I did clinical, my joke was my husband knew how to make a sandwich, so we got through. Like, you know, whatever. I don't think I saw him for 8 months, and at some point I started wondering, is that why my relationship's working? Like, I don't think I have seen him much, but we haven't gotten into an argument. But listen, we're here. It's been almost 20 years and it worked out just fine. Thank you. So that's great. Weekly hour commitment for 3 years versus a 2-year program. I don't know if I've ever done that math. Dr. Thrower, do you have any input as to hour commitment? Because you do more of that didactic work.
So I think that in general, I would say that you probably need to be thinking of probably about 20 hours a week for study time. You know, a lot of people will do a couple of hours a day and then really commit time on the weekend, or, you know, on the other flip side of that, you may be working a weekend option where you get everything done during the week. That is the advantage that Frontier has, is that you can really make either one of those things work, whatever works for you. I will tell you that we are in the process of revising our program of study, where we have more of a single version of how long we think that you really should take to do it. And it's probably going to end up sort of falling a little bit in the middle of that, about 2.5 years. I think the idea of doing the entire program in 2 years, I'm just going to be really honest with you, I think that's fairly unrealistic for most people. If you happen to be single with very, very few family obligations and independently wealthy, good for you. And also that's the person that could maybe do the whole entire program in 2 years. I've just excluded myself from that for sure, and probably everybody else on the call. But that's fine, because we're not looking, that's not the demographic that we're necessarily looking for in our students. We're looking for the demographic that we're looking is very different. We're looking for somebody with the passion and the heart to care for other people. Really what I think makes the perfect midwifery student is that person who says, yes, I have a family. Yes, I have to work. Yes, I have these obligations, but I'm willing to do what I have to do to achieve this dream, because this is who I want to be. So I don't know if that helps, but I'd say to plan more on the 2.5 year mark at the least.
And so I just want to address, there's another great question in the chat about being a postmaster student. So remember, doing that online portion, after you go to Frontier Bound, when you get to meet some of your peers and get oriented to the university, you go back home, you flip on your computer and you start doing your work and interacting with faculty in your different courses. And all of that is very flexible. And like Dr. Thrower explained, and then, you know, we looked at that life plan slide before. Then something happens, you know, sometimes you need to take like a whole term off. It's called an academic hiatus, and that exists. And we have a lot of students do that in their program. So even though you set out with your plan, all of a sudden, you know, the universe doesn't care that you have a sick relative that now you have to go care for. But Frontier cares. And so we're going to give you space to do that. If you're like, I don't have the bandwidth for school right now, that's fine. Check out, unplug, and come back to us in another term. You know, we built in those safety nets because it doesn't matter if you graduate in winter 2025 or spring 2025. In the end, it matters to us that you graduate and that you join us, because we need people in the world to take care of people. And so you're those people. And so we want to make every single effort to make that happen. So the didactic piece is most flexible. The clinical piece is less flexible, right? Because now you're depending on a preceptor. So you have a CNM in your community who has a schedule, right? And you can be like, oh yeah, I work during the week and on weekends I'm going to do all my didactic. That works fine. But when you hit clinical, you're going to be hard pressed to find a midwife who works every single weekend, right? And so you're probably going to have to make different plans in your scheduling life to be available to follow their schedule, because you need to have a preceptor, you need to have an expert midwife to be there with you to train you and teach you and precept you. So that's a really critical thing to think about. And a lot of students who are postgraduate certificates, you're an APRN in another specialty, you don't have that RN 312 schedule anymore, right? You're probably working Monday through Friday. Outpatient is the most common schedule. So that requires a lot of advanced planning to take some time away from that job in order to be available for clinical.
Heather has an excellent question in the chat box. Any advice for someone who does not have a BSN yet, considering a career change from a completely different career trajectory? So first of all, Heather, let me tell you that this is a very common description of a student coming to our program, and please don't be discouraged. Again, we saw the little graph earlier that this is what we might want it to look like, but then that's what it does look like. So here's the bottom line. As Dr. Lomax said in one of her slides, you do have to be an RN before you can be admitted into our program. If you already have a bachelor's in another field, there are a lot of programs available nationally that are accelerated BSN programs where you, in about a year's time, can become complete the education required to sit for the NCLEX, which then makes you an RN, right? But then you also need to have 1 year of nursing experience. It does not have to be in any particular field of nursing, but you have to have about 1 year of nursing experience before you start with us. So the best approach is to look for the route that would work the best for you to become an RN, and then get a job working. And after you've worked for about 6 months, then it's time to go ahead and apply, because the admission process from the very time you start admitting to the time you start is generally about 6 months. You need to have that year of experience before you start, not before you apply for admission into the program. Does that make sense, Heather? And any other questions about that? I love this concept. I think that other life experiences that you bring with you from other fields, they enrich you and make you a better practitioner in a lot of ways. So I really encourage you to, you know, if this is your dream, to follow it, even if your path is maybe a little bit different. Heather, I saw your hand up. Did you have a question you wanted to just ask?
You actually asked my question. So I'm ready to graduate from nursing school in December, and going to be joining Grady's Memorial Hospital's nurse residency program on the L&D unit. And so my question was, as far as how much time as a RN should we do before we plan to apply, which you answered. So very exciting.
All right, Heather, I'm going to be looking for you. My first RN job was at Grady hospital.
I love,
Started there as an RN. I can't tell you what year it was because I can't remember that far back.
I did
They
my
hadn't invented the calendar yet.
I did my clinical experience there, and I loved the unit, so I'm excited.
And Lou, this is again, I think this is a really important question. She says, do you need an undergrad degree in nursing to be accepted into the program? You need to be a nurse and you need to have a bachelor's degree, but the bachelor's does not have to be in nursing. But you just have to have a bachelor's in something. Here's another really great question about GPA. If you're, we understand the realities of life, and most particularly in the last few years, if you look at our admissions requirements, you're going to see that it says a 3.0 GPA in your most recent nursing education program. We actually will accept accept applications from students whose GPA was 2.8 to 3.0 with some additional explanations. So we believe very strongly that there are some folks out there who are excellent candidates, not only for our education program, but to become midwives who may not quite have that 3.0 mark, and we still want to hear from you. So don't rule that out. That is not set in stone. Okay, so reach out. We can talk about that more. Let's see. If you have experience as an LPN or other experience, so if you don't have a year of experience as an RN, let's say you were a CPM for years, or you've got a lot of doula experience where you're an LPN, some of those things can be considered in lieu of that 1 year of experience. That requires a small portfolio of essays that you have to complete, but there are some options around some of those things. So it's worth reaching out and talking about your experiences with one of our admissions counselors. And Rebecca, work as a CPM is probably the most common thing that would take the place of that year's worth of RN experience. We would certainly want to consider that. Applications we accept applications on a rolling basis, so there's always an application open. You can always be applying every single day of the year. Right now, if you're applying, I'm looking for my admissions folks who may or may not be on the call, but I think right now, if you're applying, you're probably applying for the spring. I believe our deadline for winter is already closed. So it just depends. Whenever you go in to the website to look, you'll see what the next deadline is for the next term that you could be working towards. Sherry's question is, do you make suggestions or help with connections if we do not have preceptor options in our area? And the short answer to that question is emphatically yes. We have a community map that has more than 12,000 sites on it. Now that's for all of our programs, but we have a list of every site that we ever knew of, ever had a student at, ever thought of. And we have lots of folks to help you try to make those connections. So Kara's question is, do you have to have recent experience in RN as an RN, or can 1 year of experience in the past count as an RN as long as you still have an active license? And the answer to that again is yes. It doesn't have to be recent. It could have been some years ago, as long as you have a year of experience.
Just when you fill out your application, give as much detail as possible, because if you don't tell us, we don't know. So just let us know what you've been doing so that we, when the admission files come in, we have all the information we need to fill out our rubric. Like, all the applications are graded, and the more you tell us, the more we learn about you and the more points you get. So brag about yourself. Don't be shy. Don't be like, I don't think that mattered that I only did that. No,
yeah.
Tell us. Yeah, it matters. We care. We're looking for the whole person.
And Jasmine, we do not have a preference for what type of nursing. Any field, any type of nursing is fine. And again, I think that a variety of whatever experiences you bring with you to the program are going to enrich your midwifery career. So, okay. Do you suggest working in L&D while in school, even though it is not required for applying? I think that the path to becoming a midwife is a little different if you have labor and delivery experience as an RN. versus if you do not. However, both are, but at the end of the journey, you're both the same nurse midwife. And I'm going to tell you that as a nurse midwife, no one is ever going to say to you, oh, were you a labor and delivery nurse or not? Because if not, I don't want you to take care of me. No, that is not, it's really not an issue, but it is a different path. And one thing I will say is that labor and delivery is, it has a unique culture. For many of you, you know what I'm talking about. Like the ICU has a very unique culture. Did I ever work in the ICU? Absolutely not. That's not for me, because that's just not my, the speed that I work at. Same as the ED. So on a rare occasion, students will get to that experience and be very surprised by the culture, the pace, the way things work in labor and delivery, and that only way you get to know that is working in labor and delivery. So I think it can help, but it is in no way necessary. It's really a personal matter. I know Dr. Jacobson can speak to this if you want to. Dr. Jacobson, you might as well chime in there.
Yeah. So I'm the interim clinical director, and I never did labor and delivery nursing. I did med surg for 3 years, and going to clinical, the reality is that your learning curve's a little bit steeper, right? So you haven't had those hours of bedside experience looking at strips and doing cervical checks and all the things that labor and delivery nurses come with. But I also didn't walk into the patient space on labor and delivery thinking like a nurse. You know, I was following the path that my midwife mentor brought for me. So I was already in the mindset of a provider, you know, because the labor and delivery RN will walk in and start looking at the pit drip and thinking about titrating. And as a midwife, you've delegated that. And it can be very difficult to take a step back and see where now you're managing the whole patient in the entire room. So two things about labor and delivery experience just for reality I just want to share with you. One, it can be a challenge to find a preceptor who's willing to take somebody that labor delivery experience. There is some bias there. Some preceptors will say, well, I have such a busy practice, I don't have the time to slow down to teach some fundamentals. And remember, that's a gift for you, because you don't want to be with a preceptor who's already self-identified themselves and not having the time to invest in you. It's okay. You'll find the right preceptor. Secondly, Dr. Thoreau is correct, and no patient's going to ask about your labor and delivery experience. I have seen some jobs posted that say they'll take a new grad only with labor and delivery experience, at least 1 year or whatever. And that's fluky, and it doesn't happen often, but it does happen. And so again, I just sort of want you to go in eyes wide open. There are pros and cons to either. So there's no wrong or right answer there.
Thank you. There's a great question about trying to decide between being a CNM and a WHMP. We're almost out of time, Mimi. I think this is a great question that doesn't have a really quick and easy answer. I'd love to chat with you about it sometime though. So feel free to reach out and we'll talk about it. Depends a lot on the state that you live in and what licensure looks like in your state and what job opportunities are. Women's health MPs have a little more focus on the GYN side of things, maybe a little more focus on primary care, and of course don't attend birth. So things to think about, and great question, and we'd love to talk to you about that more. How long does it take to receive a decision? We do our admissions on a rolling basis. So typically from the time that you had applied to the time you hear something tends to be about a month or so, but it doesn't take a long time to know. And yes, we will talk to you about ways to improve your chances to get in and all of that. There was a question about what GPA would be considered competitive. Our application is really multifactorial, and the GPA is really one small part of it. So don't get too hung up on that. A 3.0 and better is really adequate. If you're working as a WHMP, do you get credit for the GYN? We are able to, if you're already a WHMP, we're able to sort of give you oftentimes some transfer credit for some of your didactic work and some credit for some clinical work. So that would be a great question to Shamika to reach out to Dr. Jacobson or Dr. Freed about, so we can talk to that a little bit more. these have been really great questions. I really appreciate everybody being here, but we are out of time. So I'm going to wrap us up and say thank you so much to everyone and encourage you, please, if we didn't get to your question, I'm sorry, and please reach out to us so that we can talk a little bit more about it. We would love to explore some more of these questions with you at any time.